everyone, and welcome to the Avanti Woman's first podcast on women in healthcare. The Avanti Woman is a platform dedicated to empower, connect, and build women to move forward personally and professionally in healthcare, finance, entrepreneurship, and philanthropy. Well, today I'm very excited to introduce our lovely guest, the one and only Dr. Maryam Seddigh Tonekaboni. Not only is she an accomplished and respected physician, I can personally attest that she is an amazing human being who is kind, humble, and full of integrity and compassion. A little bit of background about Dr. Seddigh. She's a respected physician with over 15 years of experience in regenerative and integrative medicine. As an integrative physician, she uses the best and most effective methods from both conventional Western medicine and alternative systems to determine the root cause of illness rather than merely relieving their symptoms. She is the founder of Health Watchers 360, a leading anti-aging and wellness practice. Dr. Seddigh provides individualized management and prevention plans for chronic diseases such as diabetes and COPD, and tailors personalized medical interventions based on one's genetic predispositions, as well as targeted IV therapy. She services and cares for a wide range of patients from their 20s and well into their golden years. Today, Dr. Seddigh will be talking about women and anti-aging medicine. Welcome, Dr. Seddigh.
Hi, Nairy. Thanks for your so kind introduction. I'm very humble, and it's great to be here. And, this morning before we start, I was just thinking about, how long we've been knowing each other. It's almost more than 10 years.
Yes.
We've known each other. And as much as, I remember you is just as an ambitious, determined woman, which had a big vision, an important mission to accomplish. Mm-hmm. And where you at right now with your company, Avanti Woman Health, I think you accomplished your mission. And it's very important, of course, it's very important to acknowledge what you're doing, what you're providing to the community, and you expanding your hands and services to holding so many hands in the community, providing the excellent first-class service, helping a lot of women to make the right choices for their own health. You connect them to the opportunities. And this is really amazing, and it's a pride.
Congratulations, Dr. Seddigh. Thank you so much. It means so much to me coming from someone like you. As a colleague, a good friend, and a physician, I've always had great respect and admiration for you and your work, which has always been grounded in competence and integrity. And not only that, from a personal standpoint, 10 years ago when I met you, you were my father's physician. And my father had Alzheimer's, which, turned into end-stage Alzheimer's. And if anyone knows about Alzheimer's, it really takes a toll on the person and the family. You reaching out to the family, to me, who was, I was the primary caregiver, in late hours of the day outside of your work, normal hours, to just ask us how we're doing, if there was anything you could do. You went above and beyond, and that speaks volumes. That, to me, I will never forget, because, it showed me that you were a doctor with incredible bedside manners, and you are an amazing human being. So thank you, thank you, thank you. So, when I say you're a physician with integrity, with competence, bedside manners, it's not just something that I read or hear from your other patients. It's something that I myself have experienced. So thank you so much, Dr. Seddigh. And
thank you, Nairy. I just want to tap on, quick, background on your dad. He was an amazing human being. Such a pleasure for me to be able to take care of his health and to contribute even a small thing to your family, and hopefully we can just continue to serving our community.
Thank you. So with that note, Dr. Seddigh, please tell us a little bit about yourself,
Sure.
your background, and what inspired you to build a career in medicine, leading to the practice that you operate today.
Absolutely. Again, I'm Maryam Seddigh Tonekaboni, and I am board certified family physician with fellowship in integrative and anti-aging medicine. And I've been practicing as a primary care physician almost more than 10 years. And if I want to just go back to my passion, I have to go back to early childhood, that I always remember I had a passion to help people, bring the smiles to the faces. And as I was growing, I found out, being a doctor and being in the healthcare is the most fulfilling dream to come true for me. And since now, every day when I wake up, I have such a gratitude uh, toward, my life, that I'm able to serve my community, my people, and I'm able to make a difference in people's life. And I don't think ever I could choose another career for myself. Um, and and also I encourage and I advocate whoever wants to be a doctor and has a passion to help the people and just holding hands.
Thank you, Dr. Seddigh. And yes, if anyone truly has followed their calling, seeing you in your practice and the way you treat your patients, it really speaks volumes. And it does say that you have followed your true calling and your passion.
Thank you.
So, as you know, we met many, many years ago when you practiced traditional family medicine. So please share with us what inspired you and why did you shift from the more traditional way of practicing medicine towards what you are doing today, wellness and integrative medicine?
You're correct, Nairy. I reinvented my practice as more of wellness and health clinic. Disease management versus managing someone's health. This is what we offer at Health Watchers 360, comparing to traditional medicine. And when I started my career as a family physician, almost maybe 8 years ago, or more than that, 10 years ago, I started working as an employee in a big corporation medical group, which I had an amazing experience, and it helps me, and it gives me the perspective that what I want to do for the rest of my career. And I always had a passion to treat the patient as a whole, or basically treating the whole patient, not focusing on just treating their chronic condition and just giving medication and just move on. I was, had a passion to have autonomy, to providing the alternative to patient, that if, it's not just all about medication. You're just, throwing a lot of, drug that you have it in your pharmacy, and to make the patient feel better. That wasn't my mission. I want to have the patient has choices. And then I decided to move on and to establish my own practice. And I named this practice Health Watchers 360 with a mission.
I love the name.
Thank you. And I had a vision to really, by saying 360, be managing the patient's health and overall well-being from 360 angle. And then I moved and opened the practice. Gradually, we started branching out the practice in a different way to just accomplish my goal. We have a lot of patients coming to our practice with existing condition, you name it, from diabetes, coronary artery disease, cardiovascular disease, COPD, asthma, hormonal, deficiency, weight problem, you name it. We definitely focusing on managing the existing condition, but the other part of the focus is just preventive medicine. That we want to make sure we're managing patients' health and just prevent them to become sick. Then that's the main goal that we're focusing in the practice, and we're in the near future we're moving to predictive medicine.
I
It's
love
not
that,
just
Dr. Siddiq. You said something, where there's that famous adage that says 1 ounce of prevention is worth a pound of cure. And that's exactly what you're practicing in your clinic.
absolutely, absolutely, because I think, the art of medicine is not just you treating the condition that it's happened to patient. The art of medicine and the technology that we have this opportunity. This is 21st century where we cannot, practicing medicine like before. It's to me, it's a shame if we're doing that. We're not doing the good job if we're just focusing on managing the diseases. Predictive medicine is coming soon. It's already here, but we'll see it in very near future that you can
Predictive.
predictive. Yeah,
Predict.
because
Wow.
exactly, because you can, by start doing certain tests, testing, genetic testing, um, checking your immune system, you can predict when patient can even get sick. You can
Wow.
just alarm them, okay, your cells is behaving this way, your gene is behaving this way, then just, change your lifestyle, change your, nutrition, do certain things that you just avoid getting sick. Then that's one of the part of you know focus of the practice to prevent, and then the other part is managing the existing condition. And next to it we have also targeted IV therapy in combined to amino acid, which will, it can, start from existing condition. We see a lot of patients with autoimmune disease
Mm-hmm.
between their chemo with cancer, or we see just healthy patients, they come to get these targeted IV therapy to just stay well and boosting their immune system to not to get sick. I was a witness during this pandemic. I had so many patients that they've been coming and getting the IV therapy, and I can tell you it's a minimal few numbers. I can tell just they got COVID, and I have very, very sick patient also that they never got COVID. That was
Wow.
the, evidence and document of what we're doing. And that's why patients coming back to us, because they see the result. They see what they're receiving and how they get protected. Also, I decided, adding another branch to the practice to complete, our wellness clinic. It was the anti-aging and aesthetic part in our, in our office. And the whole purpose of doing aesthetic medicine and emphasizing, I see, the changes in patient. I
So can
see,
I ask you a question there, because
sure.
you just tapped on it. So this is actually a very exciting question. And I've always, since you mentioned that whole anti-aging thing, I've always been fascinated by the fact that when we as women
Mhm.
hear about women and anti-aging medicine, I automatically think about, aesthetics, injectables, fillers, and all of the above that you kind of mentioned, which you and I know it's far, far away from the truth, right, Dr. Siddiq? So,
Absolutely,
so
absolutely.
please continue to share with us, why is it that you shifted to women's health? And I know, that's a huge part of your practice. It's women's health. Why did you shift to that? And number two, I know that some of the major underlying issues in the category of women's health and, premenopausal and postmenopausal symptoms, um, and manifestations is how it impacts and shapes a woman's quality of life. So, sorry to stop you,
Absolutely.
but this question
No, no.
goes, really directly to what you started to talk about. So, can you please expand on this and help us understand.
Absolutely. As you mentioned, the aesthetic part of the women health is a small part that you just can, help the patient by seeing themselves in the mirror and feel good about themselves. And as they feel good about themselves, they become more of compliant patient. They like to take care of themselves. They like to live healthier. They like to eat healthier, do more exercise, building up the confidence. And it's more than the physical changes that you see or they see. You know, it's about the connection in their brain. When they feel good about their physics and their outside, they're stimulating the connection in the brain that producing more serotonin. And I see patients that they've been going through the depression, anxiety phases. When they feel good about themselves, they look good. They're you turning off that switch of depression also. I've been a witness on that. And I use this, procedure as kind of rewarding system or incentive to the patient that you're taking care of your health, and I can just take care of your outside also, and just give you better look that you can enjoy. But going back to emphasizing about women health, during my career, I always knew that there is a better way to treat a patient. Just treating the patient as a whole, and especially women. When it comes to women health, it's not just all about doing pap smear and delivering baby or just ordering mammogram. It's definitely beyond that. And I can share as a woman, we're going through our life. We're building up our career, building up our family, and raising kids, sending them to college. And we're in the middle of the life that felt, everything is under control, and we want to stretch our legs and just relax and enjoy, our life with the family, partner, loved ones. Boom, menopause has happened.
Oh my gosh.
And this is really, really important and life-changing event for any woman. And it needs to be emphasized, and we need to give the good knowledge to patients, then they be prepared about the changes that they will expect, and they can be prepared and they can just move on smoothly and gracefully without the minimal effect on their life, social life, family life, relationship with their partners, and just in their overall well-being. And I just want to mention something that I've noticed that in my practice, unfortunately, most of the women accepting these changes as a natural change or natural aging. And they even either shy about or shameful to ask about these changes, anything from the primary doctor, to be prepared and just be open about it. What's happening to me? Why my body changes? Why my desire is so low? Why I cannot, having, my sexual life? What's happening to all this? And that's the moment, I can play my role as a primary care physician, opening the doors for women to give the opportunity and providing the questions during their health maintenance visit about their sexual life, that they feel that chapter of life, the sexual life, is as important as their heart health. And they shouldn't hide it.
So, Dr. Seddigh, you just touched upon something where, in society as women, if we believe that this is just part of life and part of our aging process, and we have a hard time to talk about it.
Exactly.
How is it that you approach your patients? Do you have a proactive way of actually probing them and pulling those questions out of them? Is that part of your protocol to make sure that you engage in that conversation with them so they ask those questions?
Absolutely. It's part of the questionnaire. It's designed in my system, and I'm just
Hmm.
very open.
That's
And
amazing.
and it's amazing when you see, as soon as you tap on and bring it up to a patient as a question, it
Hmm.
sounds like why they should be shocked about that. And you
Hmm.
see more than 90% of women, they have problem in that area, which has been affecting their life. And
They're
they've
afraid
been
to talk about it.
exactly,
Yeah.
and they've been frustrated with their relationship, and they want to keep their loved one happy, but at the same time it's just like a suffer and torturing for them. Then they don't know exactly what to do. And I want to just tap on a research which is very important research and is
Hmm.
related to anti-aging. I want to bring it up because that's the place to talk about. They did a lot of research about the sexual life of women, and many studies been done. And one of the interesting study shows the conclusion is sex and performance, sexual performance is considered as an anti-aging.
Oh,
And how
wow.
it, yeah, that's amazing. We think is just the option. It's not the option. Basically the study shows that women that have more, sexual activity during their lifetime, even more than, at least once a week, they had a longer telomeres in their DNA, which means longevity. Telomeres is a part of DNA, which, basically it's coding the longevity of DNA. And
Hmm.
they noticed that they had a longer telomeres. Then basically, I just want to emphasize that having the normal, sexual life is considered anti-aging. And that's why
Wow.
it's so important we talk about it with patient and keep that chapter open,
That's
even
very
when they're going
interesting
through phases.
because
Absolutely.
because I've heard of longitudinal studies at UCLA in genetics years ago that,
Hmm.
consuming less than 1500 calories a day also elongated your DNA telomere. It
Absolutely. We're
was
going to talk about
how
that.
funny that I had no idea that sexual, healthy sexual life did the same thing. That's phenomenal. Wow.
Absolutely. Absolutely. We'll talk about that, the other research you mentioned just later on. I have some topics about that too.
That's phenomenal. And since we're on this topic, and I know you're probably going to talk about it, but a question that's also fascinated me and many other
I'm
women
so sorry I
is,
have to interrupt you. I need you to come closer to the mic.
oh,
Sorry.
sure.
Sorry.
So a question that's fascinated me and many women is that as we age, right, in premenopausal years, we see that we start gaining weight, and losing weight becomes difficult no matter what we try to do. And in fact, people who are postmenopausal end up gaining weight. So can you also incorporate a little bit about that in your talk, Dr. Siddiq?
Absolutely. Absolutely. I just want to talk, quickly about what is really menopause, premenopause, postmenopause. There are two important, basically, let me just talk about this way. Menopause is the beginning of hormonal changes.
Hmm.
And there are two main hormones play a role in this stage of life, and there are estrogen and progesterone, and both of them are produced, they produces from ovaries. And when we go through this stage, I like to divide this to three phases, which is premenopausal, menopause, and postmenopause. And interestingly, if I say that, you will say, wow, premenopause starts somewhere between our 30 to 40. We're
Oh,
not thinking about that ever, that,
not at
anywhere between,
all.
exactly. And between age, somewhere between 30 and 40, are one of the wonderful hormone, progesterone, start declining. And we see all the side effect and changes of the deficiency of these hormone. Usually progesterone is in charge of, stabilizing our mood, keep us calm and cognitive, and controlling the amount of bleeding during our menstrual period. And when it starts declining, we notice our sleep is not the same. We cannot have so many young patients coming. I cannot sleep the same. And yes, because the progesterone start declining, and the premenopausal phase start, that early that we even not think about that. As we
I never thought in my 30s that, there was any
exactly,
hints of premenopausal
exactly,
manifestations.
that's
Yeah.
a start. And as we're moving up, to menopause, which is somewhere between our 40s to 50, the progesterone continue declining, and now our another great hormone, estrogen, start fluctuating, going up and down during this phase. And when I'm saying fluctuating, it means one day you have it, one day you don't. Then, and estrogen is such an important hormone. You know, Basically, it protects you from heart disease, from dementia. It helps for the cognitive and memory. Osteoporosis, you see a lot of women after menopause, they have a problem with their bone and osteoporosis because no estrogen. Sleep pattern, you see the changes in your hair, thinning, losing hair, your skin, you don't have that flawless tight skin that you used to have in your 20s. You see the wrinkles, sagging, jowling, all the complaints between age 40 and 50s, you start noticing that. And these are all because of lack of estrogen hormones, such an important hormone.
Wow.
And I want to, tell you, when estrogen goes down, there are two important effects we will witness witness in the body, as well, the changes in the metabolism. I would like to ask Annie to pull up one of the chart that it shows the, basically the hormone changes. Let's see. Gonna look at this is a phase that I just mentioned about, early 30s and 40s, premenopausal, progesterone going down. In menopause, estrogen start fluctuating, and the postmenopause, both of them are low. And the next slide, if I want to show, this is about the estrogen hormone and how important is this hormone. Look at low estrogen. What's the effect of low estrogen? Basically, when you have low estrogen, your insulin cannot, do their job. Basically, it's just getting accumulating behind the cell doors. And what it does, it's just increasing the amount of blood sugar in your bloodstream, because insulin is it's the key for your what they call it. It's a key for your cells. Then it just allow your blood sugar easily go to your inside to your cells and just have a normal metabolism, burning, creating energy and everything. And when you don't have estrogen, your insulin does not work. And it's gradually creating the insulin resistance because of insulin's accumulating behind the door.
Wow.
And what it does, your blood sugar, instead of going inside the cells, is just going back to your liver and converting to fat and causing fatty liver. And fatty liver, it means poor metabolism, and it means that, gaining weight. You start seeing that you do your best, you're not eating anything, you're doing exercise twice more, but you still gaining weight. That's one effect of the low estrogen in your body. The other important effect of low estrogen is an effect on your mitochondrial. And mitochondrial is such an important organ inside your cells. Is like a control center and doing detox for your cells and controlling your metabolism, making energy by creating ATP inside your cells. Then when you are low, and estrogen, poor mitochondrial function, what it happen, low fuel, low energy, you feel fatigue.
Mm-hmm.
and you start losing your muscle, and everybody come and say, oh, I don't know why I have a saggy muscle in my arms and everywhere. That's because you don't have enough estrogen. You're feeling fatigue, and again, the same as other, the other things that we mentioned, gaining weight, poor metabolism, sleep problem, and so on. Then, see, this is very important. You have the important, hormone that will be missing during your menopause. And if you don't know what you can do to create a natural estrogen, progesterone, then you think, okay, that's done. I'm done. This is the chapter of life. I have to deal with it and suffer for the
Yes.
rest of my life.
One little hormone.
One little hormone.
Wow. So I have a question. This is a very interesting chart. If low estrogen also causes insulin resistance, do women as they age also become more prone to developing type 2 diabetes because of this factor?
Absolutely. Absolutely. We see a lot of women, they don't have any family history, and they just swear nobody in their family has any problem with diabetes. Yes, if they start, saying, pre-diabetes and become diabetic, and it's affect their thyroid. They see, more low thyroid function, hypothyroidism. These
Mm-hmm.
are all effect of, low estrogen, how it's just affecting other hormones. And the hormones is work like a harmony. And it's not just, one hormone you want to treat, that just that single hormone, get the supplement and fix it. It's just the entire system needs to, work together. That works like a harmony. Then you have a normal, metabolism, and you can enjoy, your overall well-being. Then some patients, they say, okay, just give me some estrogen, progesterone. It doesn't work that way. You have to
Uh-huh.
look at the whole entire system, how you can just open up these cycle, that it can work, beautifully next to each other.
So basically, what you're saying here, Dr. Seddigh, is that, this is not a black and white regimen. It's very individualized. Each
Exactly.
person is different. So if this was me, for example, you would
Mm-hmm.
be running a full on, hormonal test panel on me. And then you would look at my underlying factors, other components, and then you'd put a regimen and a system that's just tailored for me, correct?
That's correct. Certain things, as that we will talk about it shortly, it's about everyone. It's
Mm-hmm.
about lifestyle change for everyone. But there are certain, changes, individual changes we need to do, which is we tailor based on patient's need, based on the hormone panel that we check in the office, and we just add on to their, lifestyle that we offer. Then
That's
there are,
great.
yes.
So, I just wanted to mention, I mean, this is such a huge plethora of, an area of healthcare, women's health. It's such a, large area that we cannot target and talk about everything in one session. So I'm very excited that this actually podcast will have many different series inviting you over to continue on talking about, additional topics. But right now, what I wanted to actually take a moment to talk about is I've been waiting patiently for this question. It's a very intriguing question, which has been a mystery for many centuries. And it's that question that haunts many, especially us women. And that is how to drink from the fountain of youth. Now, from the beginning of history and mythology, people used to believe if they drank water from the fountain, the aging process would stop. So I did some actually research about this, and I found some interesting, historical facts. So they say that Ponce de Leon was said to be searching for the fountain when he traveled to what is now Florida in the 16th century. Alexander the Great, that we all know about, who conquered most of the known world before he died around 323 BC, may have been looking for a river that healed the ravages of age. During the 12th century AD, a king known to Europeans as Prester John supposedly ruled a land that had a river of gold and a fountain of youth. Basically, Dr. Seddigh, from the beginning of time, from the beginning of history and mythology, and all the way to today's modern world, humankind has always been fascinated and searching and looking for that fountain of youth. Now, you and I both know that, to drink from that fountain of youth does not really realistically exist. But what that is that we can only achieve that through practicing a certain lifestyle, right?
Absolutely.
So there is no magic, but what we make of it if we choose and follow the guidance of experts like you. So here's the $1 million question, Dr. Seddigh. Please help us understand the anti-aging secret to staying youthful, feeling great, and looking good.
Absolutely, Nairy. I've been looking for that, fountain for a very long time.
We guys, haven't we all?
Absolutely. Let me tell you, the fountain of life is a symbol. The fountain of youth is a symbol. And it's not like a miracle. It's like a recipe that you add to your lifestyle, that you can enjoy it. You can do so many things, to your outside, your appearance. You can do so many changes inside your body. But what is important, and you can also take so many medication that makes you feel better. But what we want to emphasize here today, there are 5 things is important for everyone as a recipe to add it to their lifestyle. And we will expand on every single of these 5 lessons in future, going to the details, because they're beyond of discussion of one session. Each of them, it really needs, one long conversation, basically. But I want to at least have on these 5 lessons and items that it's important you incorporate to your lifestyle, that you can enjoy, and hopefully you don't need use any more kind of prescribed medication when you when you adopting these type of lifestyle. I want to start with fasting and intermittent fasting diet. What is that? You mentioned that earlier about, fasting. And I want to just emphasize and put it as a first lesson, because this is very important. And what is fasting? Why we're talking about fasting and intermittent fasting. Fasting, it's considered as an anti-aging. And I want to explain that to you, why we call it anti-aging, what it does that, we consider as anti-aging, basically. The main purpose, that we achieve by fasting is decreasing that insulin resistance. We talk about that. And by decreasing the insulin resistance, you're decreasing the inflammation in entire your body. And you will see all the beautiful result of, loss, decreasing the inflammation in the joint, and all the other things we talked about it that you will see as a postmenopause or menopausal, syndrome. And basically, when you do fasting, you take your body to the starving mode. And starving mode is the moment that all the cells with the good quality cells can survive only. And all the other cells with the potential, cancerogenic cells, they cannot survive. They don't have a good quality to survive. Then basically we clean up some of the abnormal cells during the fasting, which consider as a detox by itself. And
interesting.
It's very interesting. It's even you don't do anything else, just do fasting, you're doing detox to your body. And what it happened during this fasting, what is the mechanism of the fasting that you feel good after that? Basically, when you do fasting, you have just a low carb diet and less amount of sugar to your system, to your body. And then your cells start, producing different hormones because they still need, fuel, they need
Mm-hmm.
energy. Then even you don't have the sugar to give them, they need to create their own fuel. Basically, one important hormone start producing, we call it glucagon.
Mm.
Glucagon is the hormone that is it's starting the process of the metabolism. We call it gluconeogenesis. And gluconeogenesis is a type of metabolism that you burn other type of product like fat to create energy for yourself.
So
What is
glucagon is a good thing to
when you
have.
yes when you go
Okay.
through, yeah, absolutely, because you want to just use a different type like your fat. You want to
Mm-hmm.
burn your fat to create energy. You don't want to just add in sugar all day long by keep eating and just create energy, because the extra calorie of the sugar will turn to fat and makes you create a fatty liver, as we talked earlier.
So
Then
basically, to simplify it for our audience, if we fast,
mhm,
fasting, intermittent fasting increases your glucagon storage, which in
hormone.
fact,
Mhm.
hormone, which in fact helps in the breaking down of fats.
Absolutely.
Beautiful.
Simple.
Wow.
And what you see as a result, weight loss. And you
Okay.
see exactly, and you see with the moment of you do fasting, and especially when you do long fasting, it creates a certain metabolites that they are very good quality for your body, which you don't see it necessarily in the normal metabolism of your daily metabolism, because it has to go to the starving mode that you see those metabolites to come into your body. Then
Beautiful.
this is anti-aging, and I want to emphasize, you see changes in your cell, in your skin, and the skin is
Mm-hmm.
the largest organ in your body because it's covering the whole entire surface and is really directly related what you eat and your gut health and the amount of microbiome that is producing to your body and is reflecting on your skin. And when you go to long fasting, I'm talking about between 24 to 72 hours fasting, then that stimulates the collagen synthesis.
Collagen.
Yes,
Wow.
that's the moment you see the collagen start producing, and you see all the good changes that you're looking forward seeing on your face.
That's
With
crazy, Dr. Siddiq. So basically, without even, putting in any new substances, medications in us, our body really knows how to heal itself and how to keep itself young by these practices. Wow.
exactly,
That's
if you look
fascinating.
at um, what's the purpose of doing fasting in different religions, it's not really about religion, it's about the well-being and health, and we don't know why they've been instructed to do. And that's the reason. The
Yes.
reason is just you taking care of your your overall well-being by doing fasting. Then basically during fasting, I mentioned your skin will start rejuvenate, your stem cells start because you get rid of a lot of unhealthy cells, then your stem cells needs to create a new cells. Then you will see a
Mm.
lot of new stem cells coming, and you feel younger, youthful, more energy, because your mitochondria start having those good metabolites as a fuel and as energy. Then you see the whole process is changing.
STEM
That's
cells, the
stem
big
cells.
conversation of the 21st
Exactly.
century. I can't wait
Everybody
to
loves
talk
that.
more in detail about that in the future.
Absolutely. Then this is one thing about fasting, and in general, fasting help you prevent you from breast cancer, cardiovascular disease, helping
Hmm.
you for the sleep. You feel easier to fall asleep and staying asleep. In the fogginess and mental health, you see the clarity after doing fasting, and especially long fasting. And so many other benefit you see, and weight loss, that's the ultimate goal for everyone to achieve. But I want to just, emphasize something about fasting. These days, everybody talking about it and everyone wants to jump on and start, doing fasting. But fasting, has a formula. It's not something everybody just start fasting and just, going through it, especially on women when they're still actively having their menstrual cycle. There
Mm-hmm.
are certain time during cycle we don't recommend doing fasting because it affects the amount of progesterone and estrogen.
Really? I
Yes,
never knew this. Tell us.
yes. Then
Uh-huh.
basically when you want to do fasting, the second phase of your cycle, between day 17 to day 23rd of your cycle, that's the
Mm-hmm.
time your progesterone start peaking, and we
So
don't
you don't
want to
want to
touch that
fast.
hormone. Yes, we don't
Ah,
want to
that's
touch that part. And if someone say no, I cannot, this is my lifestyle, I say do just 10 to 12 hours fasting maximum. We
oh
don't go
wow.
more than that. And the other part of the cycle that is important, you eat your carb still. It's the first few days of your cycle that you have, your bleeding and everything, menstrual bleeding, because that's the time your body needs a lot of, fuel to burn it. And if you go on low, on the energy and fuel and carb, basically you become very jittery and
Mm.
unhappy, and is
Mm-hmm.
adding up to your PMS or the first few days cycle syndromes. Then you want to have the first few days no fasting, between day 17 to 23rd no fasting or short fasting. Then that's a secret of fasting, especially for women that they want to do during the cycle.
So again, if a patient came to you,
Hmm.
you can definitely hold their hand and tailor and design a personalized fasting regimen for them, right?
Absolutely.
Beautiful,
Absolutely. We have
beautiful.
different, products to use it also if they want to use to get some help that it be easier for them. We can talk about it later about each product, but
Very good.
they can do it even without any using any product. And the second lesson I want to talk about it is detox, and
Hmm.
detox to your body. And mainly when I'm talking about detox, is heavy metals detox, lead
Hmm.
and other heavy metals, mercury. They're really affecting your liver and causing a lot of damage to your liver. That is, the ultimate is a poor metabolism and, abnormal gain weight and not feeling good in general. So many patients, they doing everything, they don't see the outcome and the result, and they feel, why I'm not losing weight? Because your liver is so congested. You need to,
Mm.
clean up your liver that you can have a better metabolism. Then detox is very important. There are so many different type of detox we offer. You can do through IV. There are
Hmm.
certain, product we add into the IV that it's cleansing up the system. Glutathione is one of the main product that you can do, like an IV injection, or just you can also consume but doesn't have the same effect. And you can do charcoal detox that is cleansing up, the whole entire, GI system, your gut, and it just cleansing up everything. You can add, coffee enema to your basically detox, and has a lot
Hmm.
of benefit. It's not just every coffee. It has to be organic, mold free, and there are certain, we can talk about it in details just about detox. I can talk more than 2 hours for you. And you can also add L liver supplement to your detox, and just help you to have a better detox and detailed detox for you. The
Amazing.
third lesson, the third lesson will be your gut health. Your
Hmm.
gut health is so important. What you're adding into your body, it's so important. And the reason is so important, we have a good bacteria, we call it microbiome, in our gut, inside our colon and intestine, that their
Hmm.
job is very important job, and we don't even know about that. That's why I want to emphasize for patients having, you know um, poor diet on vegetable, having chronic constipation, or eating a lot of carbs and red meat, they're damaging those good bacteria. And part of the microbiome is, we call it estrobiome. that is producing the natural, hormone of the estrogen for our body. Then if we take care of microbiome, you can have the natural estrogen in your body. Then this is how important, and you can achieve it by the amount of vegetable and different type of vegetable and greens that you can add into your diet throughout the week to increase the amount of microbiome, in addition to the supplement that you can take, probiotic.
That's amazing. No wonder I've heard of it, that they call the gut the second brain of the body.
That's very true. And there is connection, because those microbiome in, helping for the production of the neurotransmitter. The neurotransmitter, it means the connection of the neurons in your brain for the, mental health, for your cognitive, for function, in entire body. You need to have these neurotransmitter, produced in a healthy amount that you can function properly. Absolutely.
So definitely, it's in our control by what we eat, how we treat our bodies, and how we keep our gut. We can really influence our mental health.
Absolutely.
Would you say that?
Directly.
Yeah, directly influence it. Very
directly. Good. Yes. And the fourth lesson will be your healthy adrenal gland. What does it mean? Adrenal gland is the important gland that's producing the hormones that you're missing during your menopause, which is estrogen, progesterone, testosterone. When the ovaries say goodbye and they shut down, they hand it to adrenal gland. And there is a part inside the adrenal gland that's producing these hormones.
Oh.
All of them, estrogen, progesterone, and testosterone.
I never knew that.
Yes. And that's so important. We call sometimes go-go syndrome.
The stress hormone.
Exactly. Fight and flight.
Yeah.
Women that have a lot of, stress in their life, and they always on the go, and they want to do so many things at the same time. A lot of, rush and hurry in their life. They're producing unhealthy hormone from the adrenal gland. We call it cortisol.
Cortisol.
And cortisol will affect your insulin, an amount of the production of the blood sugar in your body, increasing the glucose in your body and producing the more insulin, causing insulin resistance. And it's just a whole, metabolism problem that we talk about it. Then it's so important that you introducing the relaxation, yoga. Take some vacation. Even, one day getaway, it helps to calming your adrenal gland, not producing too much cortisol. Massage. Everybody says, I need a massage. And that's your body. That's correct. It's not just the fancy massage that you feel. It's just about your body, your adrenal gland asking you. Because the amount of cortisol in your body causing tension, and you need to relieve it. And it shows, people having, animal, pet or dog, and when they're petting, it's just actually increasing the good hormones like oxytocin, decreasing the cortisol, and it just causing general, helping for metabolism and overall well-being and youthfulness. That's the adrenal gland. And you can also get some adrenal supplement, anywhere. But we talk about a special brand if you need it. The last, lesson is the fifth lesson is it's all about, your diet and your nutrition. What natural nutrition you can add to your lifestyle, to your diet every day, that you can achieve more of natural hormone versus, the prescription, medication hormones. Then, the oil that you're using it for cooking your food, adding to your salad, it's very important. I always recommend, using avocado oil, olive oil with filter and organic oil, and also sesame oil. They're very good, but if you want to just, high temperature, don't use olive oil, because it turned to, basically, bad oils and just fatty, complex chain that is not healthy for you. then that's one of the one part in about your diet. And the other thing, certain vegetable you need to add in to your diet, and they're included of broccoli, Brussels sprouts, cauliflower, and also seeds like pumpkin seeds oil. You can use squash, and also beans. Adding to your diet. They are full of natural estrogen, and you can enjoy them, and you can see the benefit of each of them in your metabolism. And as much as
Wow.
you eat, and as much as you eat different type of grains, you will adding up to your microbiome. Then if you just eat one type of vegetable throughout the week, that's not going to be helpful.
So consistency, and basically building a lifestyle.
That's exactly.
This
Wow. Is the 5 things that you can just call it, that
the five
fountain of youth.
So the 5 basically the fountain of youth is comprised of 5 elements that we must actually understand and put into practice. And they are, as Dr. Seddigh mentioned, it starts number 1, intermittent fasting. Number 2, detox the body. And you mentioned a couple of elements, how to do that with glutathione, charcoal, or coffee enema. Number 3 is to focus on the gut health. Number 4, which is also known as second brain, right? Absolutely. Number 4, to keep healthy adrenal glands, and how we can do that, because the adrenal glands are directly affecting our other hormones. And number 5, diet and nutrition. So I can't wait to have you on in future podcasts so you can actually cover these 5 elements and break them into more details and explain to our audience, what they are and how they can achieve those. So, Dr. Seddigh, we're so excited to have you on this podcast. Can you tell us how, how our audience, our women, can contact you?
Absolutely. It was a pleasure to be here, and we have, website at healthwatchers360.com.
I think Ani, I think Ani may have a slide on that. Ani, can you put that on, please?
That's my Instagram. It's at Dr. Maryam_Seddigh.
So your website is healthwatchers360.com?
That's correct.
Very good. Awesome. And any last words of advice, Dr. Seddigh, before we wrap up?
I really enjoyed being here, and I'm looking forward to give more information about how simple you can enjoy your life and being healthy, and in the future sessions with you. And any question, anything that you feel your audience need to ask me, is simply just messaging us through the Instagram or website, or simply they can call the office and ask for appointment and consultation. We can hold their hands.
Awesome. Thank you, Dr. Maryam Seddigh Tonekaboni, our amazing doctor, physician, guest who gave us an incredible amount of information on women and anti-aging medicine. And we look forward to hearing from you on the 5 elements that comprise the secret to keeping that, fountain of youth. And thank you everyone for tuning into our podcast, the Avanti Woman, which is a platform for women where we empower, connect, and build. Please visit us at theavantiwoman.com and our Facebook, Instagram, and Twitter accounts at The Avanti Woman. At the end of our podcast, we will have Dr. Maryam Seddigh Tonekaboni's Health Watchers 360 information. And thank you, and have a wonderful day. Till next time.
Bye-bye, Nairy.
Thank you, Dr. Seddigh.